As you get older, your chances of developing heart valve disease increase, especially for people over 80. But there are effective treatments, and many of them don't necessarily mean a major surgery. Hi, I'm Dr. Serguei Melnitchouk, a Mass General Brigham cardiac surgeon. What is heart valve disease? You have 4 valves that open and close when your heart beats, allowing blood to flow through the heart and to and from the rest of your body. The 4 valves of the heart are aortic valve, mitral valve, tricuspid valve, and pulmonary valve. Heart valve disease is when one or more of those valves doesn't work the way it should. Types of valve disease include regurgitation, where a valve doesn't close properly, allowing blood to flow backwards into one of the heart chambers; stenosis, a narrow or stiff valve that restricts forward blood flow; and atresia, when someone is born with a valve that didn't form properly or is missing. These cases usually affect very small children and in very rare circumstances can present later in life. Any of the valves can have either regurgitation or stenosis, or have a mixed pathology. We are more likely to get valve disease as we age, and it affects both men and women. Additional risk factors include family history of heart disease, high blood pressure, high cholesterol, diabetes, history of smoking, history of rheumatic heart disease, autoimmune disease like lupus, history of radiation treatment for cancer. What are the symptoms of heart valve disease? You may not have symptoms in the early stages of heart valve disease. When symptoms do happen, they vary depending on the valve affected and the underlying mechanism, and may include shortness of breath on exertion or even at rest, fatigue and decreased stamina. People will sometimes take increased naps. Rapid or irregular heartbeat, felt as palpitations or fluttering, dizziness, lightheadedness, or even fainting, chest pain on exertion, swelling of the ankles or belly, fever in cases of endocarditis when the valve gets infected, a bluish tint to the skin, lips, and nails. How do we diagnose heart valve disease? Your doctor will listen to your heart with a stethoscope to check if you have a murmur and check your pulse to look for signs of an irregular heartbeat. The most common test we use for detecting heart valve disease is an echocardiogram, where we use sound waves to create videos of your heart that show the valve function. Other tests we may use are electrocardiogram or EKG to measure your heart rhythm, chest X-ray or axial imaging in the form of a cardiac CT scan or MRI to get detailed pictures of your heart, and a stress test to measure how your heart handles physical stress. How is heart valve disease treated? We can manage less severe heart valve issues with medications like antihypertensives to control high blood pressure or diuretics to reduce fluid buildup. When the valve disease progresses, some people might need surgery to repair or replace valves affected by disease. Certain valves, like the mitral valve or tricuspid valve, can be repaired in most cases. We like to preserve the patient's own valve tissue when we can because it lasts longer. However, in some cases, the valve cannot be repaired and needs to be replaced. We replace heart valves with either mechanical valve or a tissue valve made from a pig or cow tissue. Heart valve surgery can be done either through a sternotomy, where we go through the front of the chest, or a small incision on the right side of the chest called mini thoracotomy. This approach works well especially for patients with mitral valve disease. There are even less invasive procedures that go through blood vessels in the groin to either replace the valve or place a clip on the valve. This procedure is done on a beating heart. Minimally invasive surgery can be done using endoscopic instruments or a robotic platform. We use high-definition 3D pictures of your heart to guide us during the procedure. Success rates of the procedure are the same as a sternotomy. Cardiologists can also perform a procedure called transcatheter aortic valve replacement, or TAVR. During this procedure, the valve gets inserted with the help of a catheter through a blood vessel in the groin. The catheter is advanced into the heart and is used to guide the new valve into place. In comparison to sternotomies, minimally invasive surgeries or procedures typically offer a shorter hospital stay and recovery period and allow a fast return to a normal lifestyle. Heart valve disease is very treatable. We have effective surgical and interventional approaches that help people to address their valve issues and continue living healthy lives. Thanks for watching. I am Dr. Serguei Melnitchouk. To learn more about other types of heart disease, click here. And don't forget to subscribe.